Senior Moments, the show where we talk about all things senior, the good, the bad, and the utterly ridiculous. I'm Susan Tomasich, and today I have with me Laurel Joliff, and she's going to talk about one of those ridiculous things, which is called Medicare. Welcome, Laurel.
Thank you so much, Susan. It's so good to see you again.
Nice to see you too.
Thank you.
Yeah.
There's a lot of changes coming up. There's a lot in Medicare that is ridiculous. The jury is still out as far as the changes, whether or not they're ridiculous, but there's definitely some changes, and we can talk about those.
Yes. Well, I just find a program that needs a whole course of study to understand it to be a little too complicated for average people like me. So that's why I think it's a little bit ridiculous.
It is.
But that's why we've got you.
Well, thank you. Thank you.
Yeah.
You know, I have a lot of very, very, very smart clients, and they're embarrassed when they say they can't figure it out. And so that's all to say, it's really hard.
It is very hard.
It is. That part is ridiculous.
Yes, absolutely.
And so the smart folks, the challenged folks, it's ridiculous all the way around. And so yes, that is why you use someone like me, who's a licensed professional, who studies this stuff all year long.
Correct. And you represent all of the options in the Tri-County area, correct? You don't pick and choose who you represent.
That is correct.
You're giving...
That is correct. I'm a broker, and so I am certified and contracted with several different carriers that are available here in the Tri-County area.
Great.
All of them, actually.
Yeah.
Yeah. That way I can give you a very fair assessment of what's available and have you choose what you want to do. It's not up to me. It's up to you.
That's right. So tell us about some of our choices. Well,
so what I'd like to do is go over the Inflation Reduction Act.
Okay.
Those are the big changes. The Inflation Reduction Act actually started in August of 2022. And last year was the first year part of it was implemented. And it'll go through many changes until 2032.
Okay.
And so that's when it will all be said and done. And there will be changes every year that are leading up to the final Inflation Reduction Act.
Okay.
So that's how that works. Last year, it started with, one of the examples is, and most insulins are now $35 a month. Not all, but most. And so that's helpful for many. Those who are dependent upon insulin really appreciated that. And so that was a really good thing. This year, there are several other, I say last year, and actually that was the 2023. And 24 had some changes, but in 2025, there's going to be a few bigger changes. For example, there were 4 phases of a drug plan. And so basically, let me start by saying that this affects anyone who has a drug plan, a Part D, as in David, as well as a Medicare Advantage plan.
Okay.
And or an employer plan that includes a drug plan. So all of those are affected by these changes, okay? It's important that we talk about it now because a client of mine, who's a friend, actually most of my clients become friends, called me today because she got a call today, from someone who it was inferred that this person was from Medicare. She didn't actually say it, but it was inferred, implied, and she wanted to know whether my client had Medicare A and B, and of course, if they were really from Medicare, they would know that.
That's correct.
But by the way, Medicare will never call you, and so that's a biggie that everyone needs to know. And they wanted to know if she had A and B, and then she started to connect her with someone else, a licensed person probably, that can tell her all about the changes coming up, and she can get a plan with dental coverage and vision coverage, and she might even get some of her Part B back. It's called a Part B buyback. And so let me connect you with a licensed person, and they can tell you all about it. Well, unfortunately, I should say, for my client, the call was disconnected, and her husband quickly reminded her, call Laurel. She knows what she's doing, and she can explain it all to you. And so the calls are starting, And so that's why this meeting with you here today is so important, to make sure people are on the defense. They know what their
Right.
rights are. They know, these people are not supposed to call them. It's illegal for them to call them unless they're clients. And so, but again, this person didn't even define who they were with. And
That's
so,
always my first question. They'll ask for me by my name, and I'll respond with, who am I speaking to? I don't tell them, yes, it's
right,
me. I just
right.
respond with, who am I speaking to?
right.
I want to know who I'm talking to first.
Right, absolutely, yeah, and again, Medicare will not ever call you,
Yeah.
okay, so that's super important. The changes that are being made to the drug plans, whether it's a standalone prescription drug plan, a Medicare Advantage plan, as well as an employer plan, those 65 and over that are working and they have an employer plan, those plans are changing also.
Okay.
Okay, so that's kind of important. I have my notes here because this is brand new information. It came out a couple months ago. However, a couple weeks ago, it was modified, and so these changes are happening.
And when does the enrollment period actually start?
Great question. October 15th
Okay.
through December 7th.
All
That's
right.
the only time someone can add or change a drug plan or a plan with a drug plan, like a Medicare Advantage plan.
Right.
So October 15th through December 7th only. That's called annual election period. That's when the TVs blow up with all these advertisements with Medicare. And so be aware, and that's also when your phone's going to ring off the hook. I recommend all of my clients to say, I have an agent, take me off your list, because they have to.
Oh, that's a good idea.
Absolutely.
I just tell them, I know you're not from Medicare. Medicare never calls me. Go away.
Absolutely, absolutely. And so I wish more people were as determined as you when they answer the phone. But they think I should talk to Medicare because they're important.
Exactly.
Yeah.
And I was raised to be polite.
Right. Well, you can be polite and direct.
So,
You don't have to be rude.
yeah.
Okay. So
Can I stop you one more time?
You
I'm
bet.
sorry.
Absolutely.
Would you just refresh our memories, my memory, and tell me what Part A is and what Part B is?
Absolutely. So Part A is hospital insurance and a few other things.
Okay.
Part B is doctor's insurance and a few other things.
Okay.
Part A is free for most people, and for most people, Part B as in boy is $174.70 a month.
Okay.
That's if they're not a high wage earner 2 years ago.
Right.
And so if they are a high wage earner 2 years ago, which means a little over $200,000 for a married couple,
Okay.
then they're going to pay more for their Part B premium as well as their Part D as in David premium. That's
Oh, interesting.
That's
I had no idea
Yeah.
it would affect the.
yeah. And so every year it's reassessed. So
Okay.
oftentimes someone retires from a great job
Mm-hmm.
and they made great money 2 years ago and now they're on a fixed income, but they're not calling it a penalty, but they are in fact paying more for their Part B and their Part D because of their income 2 years ago.
Okay.
Some people sell a home and now all of a sudden they had all this influx.
Right.
And so you can appeal it if it's not a normal income.
Okay.
And so that helps in that situation.
So may I ask, is there a Part C?
There is a Part C.
Okay.
That's a good question because we've got A and B and D, and so people are thinking, wait a minute, alphabet says there's a C. Part C is Medicare Advantage.
Okay.
So the Medicare Advantage plan includes an A and B. It's different than a Medicare supplement plan,
Right.
and so they're totally separate. But a lot of people, even my client today said, well, that's what I have, right? When I said, well, that's a Medicare Advantage plan. I said, no, you have a Medicare supplement plan, which most people in this Tri-County area have, is a supplement plan.
Right.
We do have Medicare Advantage plans available to them, but they may or may not be the best thing for them. And so what I do is when I sit down with someone for the first time, we go over their needs, their prescriptions, how often they go to the doctor, which doctors they see, because a doctor doesn't have to take the Part C, the Medicare Advantage plans.
Right.
And then, of course, those Part Cs change every year. And so I know of a new one coming into Calaveras County, at least, probably to Amador and Tuolumne as well. And I don't know if any of the current ones are going away yet. They may.
Okay.
They may. Sometimes they go away because it's not profitable enough for them, because
Sure.
they're, of course, in business to make money.
Oh, that's what I've been doing wrong.
I know, they all are. They all are. So, would you like me to tell you about some of the changes that people will see this next year?
Absolutely.
Okay, so the prescription plan, the donut hole, or which is really the coverage gap, is being omitted. It's gone.
Okay.
And so now in 2025, I say now, I'm thinking 2025 already.
Sure.
In 2025, the most that anyone will pay for their prescriptions, as long as they're on the formulary and covered by the plan,
Right.
they'll pay $2,000. This year, it's $8,000.
Okay.
And so they won't pay any more copays after $2,000. That's their true out-of-pocket expense. That's what that's called.
Well, that's $500 a month going back in their pocket.
Right. However,
Oh, okay. There's always a however.
that's $6,000 a person difference across the country.
Okay.
And so right now, that $6,000 is going to be paid by the insurance carrier, the insurer,
All right.
and Medicare. Well, someone's going to pay for that.
Okay.
And so that means we expect premiums to go up quite a bit. Premiums and copays.
That makes sense.
The Part D deductible is going to be, this year it's $545. It's going to go to $590. Not that big of a deal. However, some copays are $5 or $10. I expect those to go up.
Okay.
If a copay is $50, per month for a particular prescription, I
Right.
expect that to go up.
So the copays differ. So if I get one drug, I might pay $5 copay, and if I get a different drug, I might pay a $20 copay. Is that correct?
Yeah.
Okay.
So all the drug plans, and this includes a Medicare Advantage plan that has a drug plan, have tiers. And so depending on where that drug lies in their tier structure, that determines what their copay is.
Okay.
So a company will say a tier 1 is a $5 copay. A tier 2 might be a $15 copay.
Okay.
A tier 3 might be $30 or $40, and a tier 4 might be $100.
I'll be darned.
So all companies and plans have their own tier structures. They're all different from one another.
I never knew that before. I don't even remember. I guess I got an antibiotic a few months ago. And that's when I found out I had different copays. Because
Yeah.
one thing I had paid $10 as a copay, and then I got this antibiotic, and it was a $5 copay. And I was
Right.
like, well,
Right.
that's really interesting. I've never
And a lot of
experienced
people
that
say,
before.
well, it's a generic. I'm not worried about that. Well, generics could be tier 1 or tier 2, depending on the generic.
Sure.
And so I say, what is it?
Oh,
And I'll do the
absolutely.
research for them when
Yeah.
we do our annual checkup, which we'll talk about in a little bit.
Okay.
Another big change that's happening is they're going to do what's called, I got to read it, the Medicare Part D offers a prescription payment plan. And so what that means is, let's say someone has a $500 a month prescription. They're going to pay $500 in January, $500 in February, March, and April, and then of course they hit the $2,000.
Right.
But that $500 is really hard to do every month.
Oh, absolutely.
And so now the government, as well as having the plans offer a payment plan, that those folks can now stretch those big payments out for 12 months.
Oh, how wonderful.
So that they have to opt into it.
Okay.
And if they don't, the company will notify the pharmacy where you would normally write the check or give the card
Right.
for, and the pharmacy will say you need to sign up for this or opt in to this payment plan, and now you can spread those payments out over 12 months. Okay, so now if you don't make your payments, the payment plan will go away. Your
Okay.
plan will not go away. They won't take that off.
Right.
But so make sure you pay those 12 payments if you in
Oh,
fact sign up
absolutely.
for it in January, which I recommend everyone do. And then you can stretch those payments out for 12 months instead of really having a harsh first quarter
Right.
because of the deductibles and all of that stuff. And so that's super important. So we got a maximum true out-of-pocket expense of $2,000 for next year. We have no more donut hole or coverage gap,
Okay.
and we expect premiums to go up as well as copays.
So if premiums and copays are going up, is this actually, do you anticipate people are actually going to save money with this
Well, it depends. I have a lot
$2,000?
of people who take generic prescriptions who are going to pay quite a bit more for their plan,
Okay,
for the least expensive plan possibly.
right.
Whereas if someone is spending $500 a month on their prescription, they're going to benefit drastically because they're only going to pay $2,000 max for the year for their out-of-pocket expense.
So does that include the deductibles? Like,
does
okay,
inc-
so if I'm going and getting an antibiotic and I normally pay a $20 copay, once I hit the $2,000, I'm no longer getting that $20 copay either?
That is correct. You're
Okay.
still going to pay your monthly premium, but
Right.
you're not going to pay the copay.
Okay,
Yes, because that $590 deductible is in that
Sure.
$2,000.
okay.
Yeah, so that's super important to know. So they're going to pay basically 25% of the cost of the drug until they reach 2,000.
Okay,
If they've reached 2,000. If you don't, then you're good. But if you anticipate a higher copay, your true out-of-pocket expense will be $2,000
okay.
for the year. That's a January 1 to December 31 year.
That is amazing, especially for people that are on cancer drugs. Or does that include cancer drugs?
Well, it depends. No,
Okay.
I hate answering it that way. If a prescription is administered by a physician, like many chemo intravenous drugs are administered, that's under Part B as in boy, typically.
Oh, I'll be darned.
Typically.
Okay.
There are exceptions to every rule, of course. If you get it at the pharmacy, there's also chemo drugs that you get at the pharmacy.
Sure.
That's under Part D as in David.
Okay.
Yeah, so that matters.
Yes, absolutely.
So when someone goes to the doctor and the doctor says, okay, I think you need XYZ drug, you give him your card and you say, here's my plan, find something that my plan covers, please, if you can. Sometimes they can't,
Sure.
but it helps you to help the doctor find a prescription that the plan covers as long as that communication is there. So you need to communicate,
Okay.
bottom line, okay? The biggest thing that I highly encourage everybody to do is to have the annual review with your broker.
Okay.
High Cap is wonderful. They are volunteers and they're going to be educated on this stuff when they get the information. This is my livelihood, and so because I'm licensed and I'm contracted with these companies, and I get paid by the company, by the way.
Sure.
I take this very seriously, and so I follow these changes meticulously. And so my clients need to call me every year.
Yes.
And sometimes, usually they don't. If there's no changes, they say, no worries.
Right.
But the thing is, in September, everyone gets what's called an annual notice of change.
Okay.
All right? And it's a book. And it shows what your payment will be, your premium, as well as the deductible, as well as the changes in the prescription plan. The problem is most people don't read it. Why, do you ask? Because they're also getting junk mail. Lots of junk
Right.
mail this time of year. And so they just think it's one of the other 50 pieces of junk mail that they got that week.
Absolutely.
And so I implore everyone to read every piece of mail. Now, it has to come from the plan you currently have. If you have a Humana plan and you're looking at an Anthem plan for your information, you're not going to find it.
Right.
Your Humana plan is who's going to send you that annual notice of change. It's with whomever you're with your prescription plan. That's the annual notice of change that you need to be aware of and you need to read.
Okay.
Okay? I actually will be in an office in Valley Springs in La Cantena Plaza for those last 3 months of the year because I expect to be super busy with folks not understanding the change. And so, again, read your mail. The month of September, they have to send it before October 1st,
Okay.
which is why I say in September, read every bit of mail.
All right.
And if you have any questions at all, I tell folks, just keep it, put it in a pile, bring it to our meeting.
That's
and we'll
a
go
good
over
idea.
it. If it's legitimate and it's important, we'll read it, and if it's not, we'll get rid of it.
Sounds like a
But
plan
that
to
way,
me.
you don't have to worry about, did I just throw something important away?
Exactly.
And so, yeah, that's super, super important. So, yeah, read that annual notice of change. It's okay that if you don't understand it, most don't. And that's what we're here for,
Okay.
okay?
So then to clarify, or to be clear, the Advantage plan and the drug plan you need to pay attention to right now, because between October 15th and December 5th,
7th. December
7th,
7th.
December 7th,
Mhm.
if you want to make a change, that's the time to make it. If you try to make it outside of that time, you can't change the drug plan at all.
Correct.
And
Correct.
so you also can't do an Advantage plan
Correct.
outside of that time.
That is correct.
But then when it comes time for your birthday, if you have a supplemental plan, then you need to be looking at your supplemental plan at that.
That is
time.
exactly right. A lot of folks get those mixed up, and that's okay. But the Medicare supplement plan, which is your F plan or G plan or N plan,
Okay.
most people have those three if they have a supplement. Yes, we have what's called the California birthday rule. So right around your birthday, you can change to an equal or lesser plan with
Okay.
no underwriting. And so some companies, well, they all go up every year because you get a letter that says, "Happy birthday, your new rate is." So that's how they work.
Yes.
They all work that way. There's no exception there. But it does give you an opportunity to shop around. And so I tell folks, call me the month of your birthday and we'll go shopping. And it's a
Okay.
5-minute phone call with me. If I don't know about anybody else, but with me, it's a 5-minute phone call and we shop.
So I went for the best plan I could get. But if I hadn't and I wanted to go to an F plan now, you're telling me I can't do that anymore?
Nope, didn't say that. So let's talk about that. So the F plan is available to anyone that had Medicare prior to January 1st of 2020.
Okay.
It doesn't mean they'll get it. It means they're available to you.
So I must be G then, because I'm,
So probably G, yes,
Yeah.
for you. So the F plan, let's say that you're 75,
okay.
which means you had Medicare prior to January 1st of 2020. Okay? And let's say that you have a G, because that's what you wanted then. That's what
Right.
someone sold you then.
Okay.
And you said, you know what? I don't like that Part B deductible. It's going way up. I don't like that. And so let's get the F plan. Well, I'm going to say, well, how's your health? I'm going to answer some health questions. I'm going to read to you the application for the F plan.
Right.
And depending on your answers, the company will say yes or no, depending on your health. You're underwritten. That's what that's called. So that's why I say it's available to you. If you pass underwriting, you'll get it. And if you don't, you keep your G.
So the moral of the story is start out with the best insurance that you think you're going to need, because later on it may not be available to you anymore
Because of your health.
because of your health.
Yeah.
So I am really healthy. Yay, thank you, Jesus. And I could have gone with an Advantage plan for $30 a month, but I chose
Correct.
to do the supplemental plan
Mm-hmm.
because I felt it gave me more flexibility, especially when I travel.
Right.
But had I gone the other way, I could be regretting it right now.
Mm-hmm. Could be. Could be. And it's not to say that Medicare Advantage plan is worse than the supplement. I won't say that. Many will. It depends on you. It depends on the individual.
Well, and it depends on the area you live in, I
It
think.
does. It does. It also depends on your bank account,
Right, there's that.
you know, and so
Yeah.
some people can't afford that supplement. And so the Medicare Advantage plan is a beautiful thing,
Oh, I think so too.
you know.
Yes, as long as I can afford the supplement, I'll do that. But
Mm-hmm.
if I needed to, at least an Advantage plan, you might have to work a little harder to get to the doctor, but you can still go.
Correct. Yeah. It's way better than just having Medicare by itself.
Yes.
And let me address that a little bit, because some folks have this idea that just having Medicare alone is better than nothing. as I should say, better than a Medicare Advantage plan. So the Medicare Advantage plans have a maximum out of pocket, and so that means that you're not going to spend more than, let's say, $5,000 or $6,700 for a couple of the plans that are here,
Okay.
which is a lot of money.
Yeah.
But if you only have Medicare, and let's say you have a $100,000 bill,
Mm-hmm.
you're liable for Part B, let's
Right.
say, you're liable for 20% of that. It's $20,000. That's a lot.
That's a lot of money.
Whereas if you had the Medicare Advantage plan, that $6,700 is the most that you would pay for 1 year. And so you have a cap
Right.
on that spending. And so it's not for everyone, but it's definitely better than nothing.
Oh, I agree.
Yeah.
Yes.
Yeah.
If I couldn't afford what I'm doing right now, I'd certainly go with an Advantage plan.
Yeah, yeah. The
But-
challenge is, like my client this morning got a phone call saying, oh, but you might qualify for a plan that includes dental and vision and might give you some money back with that Medicare, $180, I think is what she said in the phone. And well, this year, that buyback isn't even available in our Tri-County.
Okay.
I don't know about next year yet. But nonetheless, so this person's gonna go through all of this, and then they're gonna say, what's your zip code?
Right.
And then they go, oh, I'm sorry, it's not available. Well, we knew that.
Yes.
You know, if you talk to someone who knows what they're doing, that's local, that studies this stuff, then you'll know it's not even available to you in the first place. They're calling from Florida.
Right. And they don't understand that our local doctors are very reluctant to take Advantage plans, from what I understand.
Yeah,
That
they are. That's
they're-
very true. Yeah, we have many doctors that don't take them. But it matters for you, that individual.
Right.
Absolutely. Just because your next door neighbor has it and it's great for them doesn't mean it's going to be great for you, and vice versa.
That is true.
And so when someone says, well, my neighbor told me that I should get this, that's never a good idea.
Yeah.
Because your neighbor probably doesn't take the same prescriptions. They probably don't go to the same doctor. And their needs are different. They probably don't have a similar bank account,
That is true.
you know, and so everybody's individual. I'm going to treat everybody special because everyone is special to me.
Yeah, there you go. We are all special. And I had a question I was going to ask you, and it just went flying out of my head. Probably had to do with, dental. Dental. I don't get the dental. I've never found that it worked very well for me, even when I had it. I was dismayed to find out that when I did have it, it would cover only like half of the cost of the actual dental work I had to have done. So I had to split it up over 2 years, which, you know, that's kind of goofy too.
Right.
Just recently talked to another person who had dental and said he was trying to get some work done, and they told him that he couldn't come in for like, I don't know, 2 or 3 weeks. When he told him that he could pay cash, then suddenly an appointment was available the next day. And it was something
Wow.
that actually needed to be done
Yeah.
fairly urgently.
Yeah, I believe that. You know, in the last 16 years that I've been doing this, very few dental plans cut the mustard in my book. Right now, I offer a couple different ones, and there, you know, one has a long waiting period, and one has, and with no cap, and one has a deductible and a waiting period, but has a cap. You know, and so they're all different. It depends on your needs. Again,
Yeah.
you know, depends on the dentist that you see. Many dentists don't take them, and so and the ones that I'm recommending they're PPOs, which means most dentists take them, but they just bill you the difference, or they make arrangements to make them work. But yeah, sometimes I just say, just pay the dentist.
Yeah.
Just
I
pay
had a
the
dentist that actually advised me on
Yeah.
that
Yeah,
years ago. You know,
Yeah.
he said, you want to pay me or do you want to pay the insurance company?
Right.
It's kind of what it boils down
Right.
to.
right.
Yeah.
Yeah. We've got some phenomenal optometrists in the county, or in the area, and just pay them. Just
Yep.
it's especially for optometry. Now, I will address one thing there with optometry. If someone has cataract surgery or macular degeneration or something like that, that's medical. That's under Part A and B. It's
Right.
not vision insurance. Even if you have cataract surgery, you get a free pair of glasses because it's medical. It's It's a
Oh, I'll be
removal
darned.
of your lens, and so that's, yeah. And so that's included with Medicare. It doesn't
Okay.
matter whether you have a supplement or Medicare Advantage plan, that's included. And so that's important for someone to know, that if they can't afford their glasses, but they need, cataract surgery, get it done.
Oh, absolutely.
Just get it done.
Yeah.
Yeah.
Well, and I'm fortunate because I have an ophthalmologist as my eye doctor, so I have noticed that things get covered that wouldn't have got covered if I went to, I think it's an optician.
Mm-hmm.
Yes, so if I'd gone to an optician, so.
Mm-hmm. Yeah, yeah. Now, I'll share with you that I'm going to be doing meetings throughout the counties in the next few weeks, several weeks actually. And so watch for them in the newspaper and on
Okay.
social media. And so I'm going to be trying to address the many questions that people have and review as many annual reviews, I should say, as possible to assist folks for next year.
Okay.
The worst phone call I get is in January that says, whoa, 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 what's going on? My Social Security check went down.
Oh, dear.
And it's because their Part D plan went way up. And they got the,
yeah.
well, you know what, I didn't get it, or I didn't read it. And again, they got 25 pieces of junk mail, so I don't
Right.
blame them for that. But that's their company's out. We sent it. By law, we have to send it, so we
Right.
know you got it. Make sure you read it this time. You don't want to come January and say, what is this?
I'm not going to read it, I'll just call you.
Yeah, yeah, and that's fine too. That's exactly what I do. That's a reminder to get on my schedule.
That's right.
I have an easy calendar program where I just send it to you and you decide, you see when I'm available and just come see me.
Nice.
Yep, I'd love to see you.
And do you have a pretty good handle on not necessarily each doctor that will take, say, an Advantage plan or not, but kind of a feeling for how available the doctors are in this area that take Advantage plan?
You know, so there's one group of doctors here in town that I do meet with annually, and I want to know what they take and what they don't take and what their answer is, absolutely, because many people see them. And now, their online might show that they are accepting or they're an in-network doctor.
Right.
And as a PPO, the doctors can say, I don't think so. I don't want to be part of that. I choose to not play the game.
Okay.
And so they can say that now. They couldn't used to. They didn't used to be able to do that, and now they are able to, and they do.
Okay.
And so yes, I talk to the doctors as much as I can, but I also have clients who go to these doctors and who've told me,
Yes.
what's working. Now, of course, if someone says, well, that doctor isn't taking new patients, I always recommend try again in 3 weeks. That they change their
Oh,
numbers.
I'll be darned.
Absolutely.
Yeah.
People move away, they pass away,
Yeah.
they change doctors, and so their numbers, they're trying to meet a certain threshold, and sometimes when they go above that threshold, they're going to want to say, we're not taking any new patients, which is fine, but call them back in a month.
Okay.
Absolutely.
So, with your people that are interested in the Medicare Advantage plan, do you recommend to them before we make this change, call your doctor and make sure
Absolutely.
they're gonna?
Yes. Yeah, and I have them do it.
Yes.
Because I don't want to be responsible. Well, you told me that my doctor takes the plan.
Exactly.
Yeah, I want you to do it.
Well,
Even though I'll tell them what I see online,
Right.
but it's your job. That's that taking responsibility. Yeah. You
And
make
we
the phone
should
call.
know. I
Yeah.
mean, that should be
I feel
something.
better when you know for sure that, because you've done the phone call.
Exactly.
And we do that together. I mean, oftentimes I'm sitting there at the table with them, with you.
Okay.
And so let's call them.
That's a great idea.
And you never talk to the doctor, you talk to the billing person. Not the person
Ah.
who answers the phone, not the doctor, but the billing person, because they're the ones who know.
That is absolutely the truth.
Yeah.
Yes. Okay. So I think I'm running out of questions. I'm not running out of questions, but I think I am.
That's
to the
okay.
point where the questions I'd ask you wouldn't have the answers to because you're not the government. You can't tell me when they're gonna
Yeah.
make these changes.
Now, what I can do is after October 1st, if we have an opportunity to sit down again, Then we can talk a little bit more specifically regarding pricing.
Okay.
So we can do that as well.
All right.
Okay, but until then, these are, the reason why I'm able to share with you this information, by the way, is because Center for Medicare and Medicaid, CMS,
Okay.
has put it out there for the licensed brokers.
Nice.
And so that is why I'm able to give you this information. Normally, I couldn't, especially if it was company specific, but this is from CMS. And so this is why I'm only quoting CMS.
Good to know. Yes. All right. So is there anything else we should talk about before?
I just want to make sure everyone has my phone number.
Oh, absolutely. What's wrong with me? Laurel, what's your phone number? How do we get a hold of you?
Thank you so much for asking. My phone number is 209-786-2021.
And if I go on Facebook, I can look up Life Matters, correct?
Life Matters Insurance and Financial Solutions. That's the name of my company.
All right.
Yes, and I was Life Matters, by the way, before Life Matters was Life Matters.
Okay.
If that makes sense to you.
Yes, it
I was
does.
Life Matters Insurance way before that. I had it first.
All right. Well, it was a good name because somebody copied you, right?
That's right.
sincerest
That's
form of
exactly
flattery.
right. That's exactly right.
Absolutely.
Yes.
Well, thank you so much for coming on the show today. I really appreciate you being here, and I appreciate your information. It's I learn more about Medicare every year, and I still come up short, I think. So
As most do, which is why it's my business.
thank you. Thank you for being on the show.
I relate Medicare to, what I say is I don't speak Spanish, I speak Medicare because it's a foreign language. So don't feel
absolutely is.
badly if you don't understand that foreign language. I don't speak Spanish, I don't understand it, and I'm a little embarrassed sometimes if I should know something. Please don't feel that way.
All right.
This is it's a foreign language.
It is a foreign language, and I'm glad we've got a specialist like you available to help us
You
work
do.
our way through it.
Every day.
All right.
Thanks.
You're welcome, and thank you to our listeners. I'm glad you joined us today. Please join us again wherever you get your podcast or your videos.